Hi, my name is Shadai Tanui, and I will be conducting an oral facial examination with Shemuel Patton. She will be acting as the student. The first thing you want to do at the start of the exam, you want to collect the information about your student. You want the student's name, the date of birth, the age, the grade of the student's teacher, who referred the student for speech services, the reason for the referral, and also you want to have the date of the exam. And some of the things we're going to look for when examining the student, we're going to look at the structure of the face, the quality of the facial muscles, and we'll also do an oral examination. So before actually touching your student, you want to go ahead and wash your hands very good. Make sure you remove any rings or any types of jewelry. And you also want to make sure that you wash long enough with friction. Make sure you get under the nails and between the fingers. Rinse your hands. You want to dry your hands off completely and discard any waste. Okay. Then you want to put gloves on when conducting this examination. Okay, now, the first thing that you're going to do when looking at your student's face, you are going to look at the student's face for facial symmetry. So you want to look at the eyes. You want to also look at the mouth. You want to see if there's any asymmetry, if there's any drooping in the corners of the mouth. And look at the eyelids, see if they are partially open, completely closed. Then you also want to look at the face for any muscle movement, such as twitches, grimacing, or any spasms. And you also want to look at the mouth for any signs of breathing and drooling. You also want to look at the mouth when the student is at rest. Now, you go ahead and you ask your student to smile. And when smiling, you want to look at the corners of the mouth, once again, to make sure that there is symmetry. You want to look and see if the corner of the mouth deviates to one side. Then you go ahead and you ask your child to open their mouth wide. Go ahead and open your mouth wide for me. Very good. Does the jaw deviate to one side? You want to look at the mandible. Once again, making sure that there's symmetry. And at the same time, go ahead and close your mouth for me. You want to also look at the outside of the lips to see if there is any evidence of cleft repair surgery or any scar tissue. Now, you ask your student to close their eyes. Go ahead and close your eyes really tight for me. Okay, go ahead and open them. And ask your student to raise their eyebrows. Go ahead and raise your eyebrows. Very good. Once again, you're looking for facial symmetry. And when the child closes their eyes, do they close the eyes evenly? So as you're doing this, you do want to go ahead and collect your data and mark it, okay? Because you're doing this exam in sequence. Okay, now we're going to look at the structure, integrity of the lips. Once again, looking at the corners of the mouth to see if there's any drooping, any asymmetry. And look at the tissue. Is there adequate tissue of the lips? And when the child is at rest, do the lips remain closed or are they apart? And is there sign of healthy breathing? Does it look like your child is having problems breathing or struggling to breathe? Okay, very good. Lips nice. Okay, there's no evidence of any surgeries. No scar tissue. Okay, I want you to go ahead and smile for me. Smile very wide. Once again, looking at the corners of the mouth for symmetry. And I want you to go ahead and pucker up your lips like you're blowing me a kiss. Very good. Now I want you to alternate between smiling and puckering up your lips. Go ahead and do that for me a few times. Okay, and while you're doing this, you're looking to see if the range of motion is adequate for speech. Okay, you can go ahead and stop. Thank you so much. And when the child is puckering their lips, does it look like the lips are favoring motion to one side? Now I'm going to have you puff up your cheeks. Okay, go ahead and hold your breath, and I want you to do it for 5 seconds. 1, 2, 3, 4, 5. Okay, you can relax and breathe now. Okay, is the child, you want to see if the child's able to maintain air in the mouth for at least the count of 5. This is a very important step that you want to do, because when your child is holding the air in their mouth, I want you to go ahead and do that for me again. Very good. You want to hold the mirror underneath, and you want to see if there is actually nasal emission. Okay, go ahead, you can release it. Thank you. Now I'm going to have you say some funny sounds for me. I want you to say ooh, ee, ooh, ee, ooh, ee. Okay, go ahead and say that a few times.
Ooh, ee, ooh, ee, ooh, ee.
Very good. And you're looking to see if the range of motion for the strength of the lips is appropriate. Okay, excellent. Now we're going to do the actual oral exam. Okay, I'm going to look in your mouth. I'm going to use this tool. Okay, I'm going to look at your tongue. I'm going to look at your teeth, okay? Now, go ahead and open your mouth for me. You want to use a light so you can actually see into the mouth, look at the dentation of the student.
You have to stop. I made a mistake. I accidentally put my finger in front of the camera.
Did you stop it?
Yeah, I did.
Can you resume?
Yeah, you can actually. I just wanted to let you know that I put my finger in front of it.
And will we be able to edit this?
I don't know. Do you want
Yeah, you can. If
Okay.
you upload it and then just edit. And
Okay.
Can we edit out your whole entire fighting with the glove scene? That was hilarious, though.
Come on, seriously, because
Okay.
it takes a long time.
All right, might want to redo that part over again. And go.
Okay, so now you have the student open their mouth. Go ahead and open your mouth for me. You want to use a light to look into the student's mouth. Open your mouth really, really wide. You want to look at the tongue. You want to look at the teeth. Very nice. You want to look at the care of the teeth, if there are any missing teeth, any problems. And you also want to look at the lips, the sides of the cheeks, and the tongue. Okay, you can close your mouth. Thank you very much. And some of the things that you're looking for would be the coloration of the tongue. Does it appear normal? Open your mouth so you can see that it's nice, healthy, and pink. Close your mouth for me. And also the size of the tongue. Is it appropriate to the relation of the child's oral cavity? Okay, so that appears to be in order. Okay. When you're writing and you're examining the child's mouth, you want to have one of your hands ungloved. Okay. Now you want to actually have the child do some motion with the tongue, so you can examine the strength of the tongue, the movement of the tongue, and to see if the speed and the range of motion for the tongue is appropriate for speech. Okay, we're going to have you open your mouth for me again. Very good. Okay, now I'm going to ask you to stick out your tongue. Okay, very, very good. And I want you to move your tongue from side to side. Very good. Okay, can you do it as fast as you can? Very good. Now I want you to stick your tongue out, hold it, stick it all the way out as far as you can. And I want you to try to hold it for 5 seconds. 1, 2, 3, 4, 5. Very good. You can stick it back in. Okay. Now, when you stick your tongue out, I want you to move it up. Stick your tongue out. I want you to move it right to left. Very good. Stick out as far as you can. Okay? You want to look for any uncoordinated motion, any weakness. Now I want you to stick your tongue back in your mouth. Okay? Very good. Open your mouth for me, and I want you to open it very wide. I want you to stick your tongue out. Stick your tongue up to the roof of your mouth. Very good. And at this point, you want to look at the child's frenulum. Okay, very good. And I'm going to ask you to say some sounds for me. Okay, the sounds I want you to say la 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 la.
La 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 la.
Very good. Now, can you repeat after me? Ka, 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 ka. Stop that.
Sorry, I'm sorry.
Wait, what does this mean?
You gotta Wonder Girl when you're gonna have her.